What is abacavir-dolutegravir and lamivudine, and what is the combination of abacavir-dolutegravir and lamivudine used for? The combination of abacavir-dolutegravir and lamivudine is used alone or along with other medications to treat HIV infection in certain adults and children who weigh at least 88 pounds, 40 kilograms. Abacavir and lamivudine are in a class of medications called nucleoside analog reverse transcriptase inhibitors, NRTIs, and dolutegravir is in a class of medications called integrase strand transfer inhibitors, INSTIs. They work by decreasing the amount of HIV in your blood and increasing the number of immune cells that help fight infections in your body. Although abacavir, dolutegravir, and lamivudine will not cure HIV, these medications may decrease your chance of developing acquired immunodeficiency syndrome, AIDS, and HIV-related illnesses such as serious infections or cancer. Taking these medications along with practicing safer sex and making other lifestyle changes may decrease the risk of getting or transmitting the HIV virus to other people. How to use abacavir, dolutegravir, and lamivudine. The combination of abacavir, dolutegravir, and lamivudine comes as a tablet to take by mouth. It is usually taken once daily with or without food. Take abacavir, dolutegravir, and lamivudine at around the same time every day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take abacavir, dolutegravir, and lamivudine exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Abacavir, dolutegravir, and lamivudine help to control HIV infection but do not cure it. Continue to take abacavir, dolutegravir, and lamivudine even if you feel well. Do not stop taking abacavir, dolutegravir, and lamivudine without talking to your doctor. When to take abacavir, dolutegravir, and lamivudine. Before taking abacavir, dolutegravir, and lamivudine. Tell your doctor and pharmacist if you are allergic to abacavir, dolutegravir, and lamivudine, any other medications, or any of the ingredients in abacavir, dolutegravir, and lamivudine tablets. Tell your doctor if you are taking dofetilide, Ticacin. Your doctor will probably tell you not to take abacavir, dolutegravir, and lamivudine if you are taking this medication. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamins, nutritional supplements, you are taking or plan to take. Be sure to mention any of the following: carbamazepine, carbitrol, equitro, tegretol, others, dulfamprudine, Ampira, other medications for HIV including abacavir, inepzicam, intrizavir, Xiagen, dolutegravir, Tivicay, efavirenz, Sustiva, inatripla, emtricitabine, Emtriva, inatripla, incomplera, intruvada, others, atravirine, indolence, fosamprenavir, Lexiva, taken with ritonavir, Norvir, lamivudine, epivir, encomavir, inepzicam, intrizavir, others, nevirapine, Virimune, antipronavir, Aptovis, taken with ritonavir, Norvir, metformin, Glumetza, glucophage, Riomet, methadone, Dolafine, Methodos, oxcarbazepine, oxtelorexar, trileptal, phenobarbital, phenytoin, dilantin, Phenatec, rifampin, Rifadin, Rimactane, Inrifamate, Inrifator, and sorbitol or medications that contain sorbitol. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. If you are taking antacids, laxatives, or multivitamins that contain aluminum, magnesium, or calcium supplements, iron supplements, sucralfate, carafate, or buffered medications such as buffered aspirin, take abacavir, dolutegravir, and lamivudine at least 2 hours before or 6 hours after you take these medications. Tell your doctor what herbal products you are taking, especially Street John's wort. You should not take Street John's wort while you are taking abacavir, dolutegravir, and lamivudine. Tell your doctor if you have or have ever had liver disease. Your doctor will probably tell you not to take abacavir, dolutegravir, and lamivudine. Tell your doctor if you smoke or drink alcohol, or if you have ever had high blood pressure, high cholesterol, diabetes, or heart or kidney disease. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. You will need to take a pregnancy test before you start treatment. You should not become pregnant while you are taking abacavir-dolutegravir and lamivudine. Talk to your doctor about effective birth control methods that you can use during your treatment. If you become pregnant while taking abacavir-dolutegravir and lamivudine, call your doctor immediately. Dolutegravir may harm the fetus. Tell your doctor if you are breastfeeding. You should not breastfeed if you are infected with HIV or if you are taking abacavir-dolutegravir and lamivudine. Ask your doctor about the safe use of alcoholic beverages and medications that contain alcohol while you are taking abacavir-dolutegravir and lamivudine. You should know that while you are taking medications to treat HIV infection, your immune system may get stronger and begin to fight other infections that were already in your body. This may cause you to develop symptoms of those infections. If you have new or worsening symptoms at any time during your treatment with abacavir-dolutegravir and lamivudine, be sure to tell your doctor. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can abacavir-dolutegravir and lamivudine cause? Some side effects can be serious. If you experience any of the following symptoms, call your doctor immediately or get emergency medical treatment. Excessive tiredness, weakness, dizziness, or lightheadedness, fast or irregular heartbeat, muscle pain, stomach pain with nausea and vomiting, shortness of breath or difficulty breathing, flu-like symptoms such as fever, chills, or cough, or feeling cold, especially in the arms or legs. Light-colored bowel movements, yellowing of the skin or eyes, loss of appetite, unusual bleeding or bruising, dark yellow or brown urine, or pain in the upper right part of stomach. Abacavir-dolutegravir and lamivudine may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. Brand names of the combination abacavir-dolutegravir and lamivudine: Triumeq,